COVID is real, and we heard from patients that have suffered heart issues, lung issues of fatigue and brain fog after their COVID-19 infection. And then we heard from providers at Yale that are forming a multidisciplinary clinic in order to evaluate and treat these patients. Hearing the patients and hearing them tell their stories is so meaningful. It really, I feel, is a privilege to be able to be here, for those patients to be able to tell us their stories and understand the challenges that they face, the physical challenges that they face, also the challenge that they face at home and in their community and with their employers and in their work. And so that helps us develop and drive policy as well as research. We are working on this in the Biden-Harris administration and our Secretary Becerra. We are working to advance supports and services for patients with long COVID, as well as research programs that are so important to understand this chronic condition better. The Recover Project through the NIH, the Inspire Project, which looks more at prevalence and epidemiology through the CDC, and then of course the VA is doing a lot of great clinical research as well. The end of the public health emergency shouldn't impact the long COVID research that is continuing, but it brings up an important point. The President has asked Congress for more funding for COVID-19 in order, particularly from a health equity point of view, so that as the public health emergency ends and we make this shift to the private sector, that the uninsured can have access to services. We have not yet received that funding from Congress, but I'm sure the administration will be continuing to push for that. We are having a very measured and organized response towards the end of the public health emergency and the eventual migration of COVID vaccines and treatment to the private sector.
In this climate right now where we have vaccine deniers and mask deniers now in Congress running the House of Representatives, how confident are you can get past that to get the funding you need?
Well, so we plan to engage Congress to talk about the funding that we need, and we'll continue to work. We do have to get past misinformation in this country, but we are here to give the correct information about COVID-19 and long COVID, and we'll continue to engage Congress on that. Long COVID is real, and we hear you. So I think it's really important that you see your primary care doctor to get an initial evaluation and potentially treatment, and then your primary care doctor can discuss this with multidisciplinary programs like here at Yale, and then if your symptoms require that, a referral to programs here at Yale and other places throughout the country. Great, thank you so much. Bye-bye now.
Thank you.
Sharing my experience today with the Admiral was probably one of the more highlight moments of this experience. Knowing that the federal government is taking action, is paying attention and listening to these stories means more to me than anything else, and especially knowing that what I've gone through over the last couple of years can be led and used into the future research and to help others just like myself. That makes this experience worthwhile for me.
And what would you say was the condition that you ended up developing?
So I had post-COVID cardiomyopathy. I also have been struggling with cognitive brain fog issues, which I'm also receiving treatment for here at Yale. And I've also had the cardiomyopathy and some pulmonary issues as well.
And based off of what you were saying earlier, I'm sure it's incredibly frustrating to be able to, live a normal life, yes, and then all of a sudden be dealing with these implications so far after you.
Yes, I was very active previously. I loved hiking and being outside. I was constantly on the move, and now I barely leave my couch. I barely leave my house, and I can't really handle even a part-time job now when I used to work full-time. So that has been really difficult at age 30 to be facing those sorts of issues that I never really anticipated feeling.
And I'm sure there was just a little bit of comfort seeing the other people there today that are experiencing the same things that you're seeing.
Absolutely. Just knowing that others are experiencing the same thing. They're also feeling that sense of isolation. Right now, it feels like a part of society has just completely picked up, moved on, and seamlessly have forgotten about the pandemic. So to be struggling with the long-term consequences of the pandemic and watching everyone else just move on forward like it never happened is extremely isolating. And knowing that I'm not alone in that has brought me a lot of strength as well.
Today must have been very hard for you.
It was, but at the same time, I do feel if I don't speak about it, who will? And I had this opportunity to do this. And right now, just in the era of COVID, healthcare, medicine, it takes a long time. It moves slowly. We are in the very, very initial front part of this research. And to know that what I'm going through, could be used decades in advance to help patients just like myself, that's what I care about the most.
Admiral Levine was talking about combating misinformation. What's ironic is a lot of the people in healthcare, some nurses, were anti-mask, anti-vaccine. What do you say to them?
To them, I just wish they had paid better attention in school and learned more of the science. I wish that they could trust the science that they are supposed to be promoting for their patients as well. And that has been very frustrating as well and created a lot of divide in the healthcare system too.